Hi, I'm Dr. Adarsh Nayak. I'm the Senior Consultant Physician at TriLife Hospital. Today I'll be discussing about the complication, both short-term and long-term, of diabetes mellitus. Diabetes mellitus is a chronic metabolic disease which is characterized by increased glucose level in the body. It's either due to reduced insulin production or impaired function of the insulin, or a mix of both. Diabetes is broadly divided into type 1 and type 2. Type 1 usually happens in younger patients, wherein the most important pathophysiology is the reduced production of insulin. In type 2 diabetes, the main pathophysiology being less production of insulin and impaired functioning of the insulin. This usually happens in age group of more than 30 years of age. Today we will be discussing about the complications of diabetes mellitus. First complication is diabetes ketoacidosis, which usually happens in type 1 diabetes mellitus. Here, the patients usually present with increased thirst, increased frequency of urination, fruity odor, tiredness, fatigue, which may further progress to breathlessness and further can lead to the collapse of the patient. Next comes HHS, which is hyperosmolar hyperglycemic state, which usually happens in type 2 diabetes mellitus. Here, patient usually presents with a lot of fatigue, tiredness, disorientation, may present with seizures also. Apart from that is hypoglycemia. Hypoglycemia is usually a complication of treatment of diabetes, where there is an imbalance between the diet and the treatment. Long-term complications of diabetes is divided broadly to microvascular and macrovascular complications. Coming to microvascular complications, first we will discuss about diabetic retinopathy. Diabetic retinopathy is a condition where there is a progressive blurring of the vision, which may lead to a retinal damage and further loss of vision. Second is diabetic nephropathy. Diabetic nephropathy is a condition wherein the kidneys of the patient get affected progressively, with a creatinine going high, which may lead to dialysis. Third is diabetic peripheral neuropathy. Diabetic peripheral neuropathy is a condition wherein the nerves of the lower limb starts getting affected to begin with. Usually, patients presents with tingling, numbness sensation of the lower limb, which not addressed may further get modified to burning sensation and may even progress further. Apart from this, the macrovascular complications of diabetes is first coronary artery disease, what we usually in common language say that may develop heart attacks. Second is neurological complications like strokes. These are mostly the macrovascular complications of diabetes. Apart from these complications also, diabetic patients are more prone for infections, sexual dysfunction, diabetic ulcers in the foot further. As diabetes is a chronic complex metabolic disorder, by a strict lifestyle modification, regular checkup, modification of the medicines, regularizing the diet, the complications of diabetes can definitely be prevented, or at least the severity can be prevented. Okay, get yourselves checked regularly, meet your doctors regularly, adopt to a healthy lifestyle, take care of your nutrition, good hydration. Definitely together we can prevent the complications of diabetes and give our patients a better life.